Okay, who's doing this?
Can you see what I'm sharing?
Yeah.
Yeah, okay.
Who's doing the station?
I'm the role player.
Okay. Let me know when both of you are ready.
I'm ready.
Yeah, me too.
Okay. Okay, enter the station and start.
Hello, Mr. Cox. I'm Dr. Zaina, one of the doctor from mental health unit. How are you doing today?
Well, I'm not doing very well, doctor. I'm really very upset. I'm here to talk about one of my players whom you guys are really trying to make sure that he doesn't reach the top of his game. So I'm quite upset.
I'm so sorry, Mr. Cox, that uh you have been thinking like this, but can I just ask what made you so upset? Why do you think like this?
Yeah, it's because of Tom. Tom is a fantastic athlete, and you set him on Ritalin, and is really going to, hamper his progress. So I want it stopped, and that's why I'm upset because you're giving him a medication that is interfering with the quality of his athleticism.
Mr. Cox, I can understand your concern, and I have just talked to Mr. Tom Foster, and I have just completed my assessment, and I took permission from him to discuss his case with you. And you mentioned that he is on one of the medication called Ritalin, which is
Huh?
actually the main treatment of for his condition, which is ADHD.
I don't think he has ADHD. Why do you think he has ADHD?
So, because I've just talked to him and I asked him, like I took detailed history from him, and he mentioned that when he was around 7 years of age in school time, he had this kind of, he was very much energetic, and he has difficulty in concentration, and he was kind of starting things and not finishing it. At that time when he had this symptom, he was assessed by a doctor psychiatrist. He was diagnosed as ADHD, and he was started on treatment from that time onward.
Right, okay. So, I mean, this drug it's not good for his career. So what will happen now if we stopped it?
So this is the main medication for his condition ADHD, because he had and he continues to have the symptoms of ADHD in his adulthood as well. He also mentioned that he was quite impulsive. He'd make decision without thinking through. So this medicine Ritalin is the only medication. I mean, it's the best treatment available for him at the present.
I mean, there has to be
And it
other
has.
alternatives. There has to be something else. Can't we try? I read about non-stimulants. Can't we try something like that?
Yes, there are some other. The only alternative is non-stimulant. The one is Statera, which is atomoxetine. But he mentioned that when he was around 16, he has been tried on Statera, but he had some difficulty, like he had some side effects with his liver. So that is not the option we can try currently.
Right. So we can try. We can try it then. You said. or we cannot?
We cannot give because
Right.
he has already been tried,
Right.
so
Okay.
he had side effects.
Well, I've been really researching because Tom is a very important member of the team. So I've been researching. And can't we try Ricazoid? It's a Chinese medicine and it works very well in China.
So many people do claim about this medicine, Chinese medicine, herbal medicine, but we usually it is not recommended. The guideline that we follow in UK, the NICE guideline, it doesn't recommend this kind of medicine, and we don't actually have any knowledge in what it actually contains.
I just feel like we've hit the brick wall here, doctor, because you're not giving me anything to work with. I've talked about non-stimulants, you said no, he can't have it. I've talked about Ricazoid, you said no, and you're insisting on Ritalin, which will have a devastating effect on his career. If you're not giving me anything to work with, I mean, what do I do now?
Mr. Cox, actually, this medication, he is not using it to enhance his performance. He actually used this medication to for his treatment of his condition ADHD. And as far as these judo associations are concerned, so we can write a letter to them, to you, and to him as well, that this medication they can allow him as as a medical dispensation.
And is that guaranteed that he will, if we use this medical dispensation that you talk about, is that guaranteed they won't bother him?
So since, as I told you, we will write that this is he is using this as a medicine, and which will keep him, which will help him with his condition, which will help him to concentrate, and also his energy level will be within normal limits. So this medication is actually useful, and like any other case, we are hopeful that they will allow him.
Yeah, I'm really not sold on this Ritalin. He's on Ritalin and still I see all the symptoms you talk about, and he's also taking ecstasy. So if he's being treated with the only medication that works and he's still having symptoms, why are we still doing it? We might as well take it off then.
You mentioned about ecstasy. I actually asked him a little bit about this because it is not very uncommon, because when patients have this much energy, they also are involved in this kind of illicit drugs. So yes, he mentioned that he takes ecstasy, and I also warned him because he might get into more trouble than this prescribed medication, because if they will test that will come into his blood and urine.
Yeah, so we might stop Ritalin then with immediate effect because it's not helping. He's taking drugs, he's being hyperactive, what's the point?
And Ritalin, Mr. Cox, Ritalin is actually helping him to calm down, to concentrate and not being so impulsive. So
Time up.
instead of, stopping.
Time up. Okay. So now the feedback. Very good question. That why are we giving Ritalin if he's still impulsive? Now, see, the thing is, what I would say, what I felt, I mean, from your station is you not read the station very clearly. Okay, from like you are coming to the point, but much later. It's almost like the actor is helping you to actually get the points out of you. Like starting with stuff like I have read his case. Never say such things. Have you met
I
him?
have
If it
assessed him.
says
I have assessed him. Like I have
I've
not read, I have assessed him.
something you said about the case, want to discuss his case,
Yeah.
don't say such things.
Okay.
Plus, see, if it in your station it says you have assessed him, then it's fine. If you have not assessed him, don't say that. Okay. Be very careful. Whatever is given, use that. Okay. If you have assessed him, that's fine. Okay. The first question was, doctor, you are giving this medication and you're not really doing any good to him. And you kept saying from the very beginning that this is the only medication which is working. Why it is ADHD, why you're saying it is ADHD. So you said because I've taken a detailed history and he said that he had this problem at 7 years, right? Now, see, the actor didn't say at that time, but then they can come across and say, well, that's true, but ADHD, isn't it something which happens in childhood? Now he's grown up. Why are you saying he still needs the medication? So rather than waiting for the actor to throw such questions at you and for the examiner to get annoyed, you should be able to say why you are giving the ADHD medication even now. It is not based on the detailed history alone, isn't it? That is there that he was diagnosed with ADHD when he was 7 years. What happens after that? There's that almost that same one third rule which happens in schizophrenia. There are people who don't need medication, they grow out of their medication when they are adult. One third still continue to require medication. Some people can still show some residual symptoms despite being on medication. So, where does this person fall? Isn't it?
Yeah.
And why you are saying he's got ADHD now? So, there are lots of things which are given to you. What he's doing,
He
he's
continued to
making.
have a residual sick. Yes.
Yeah, why? How do you know the residual symptoms are there?
Yeah.
You have to give examples.
Yes.
He's making careless mistakes. You can involve the coach and say, okay, as far as I understand, okay, as far or whatever, as far as he told you, I don't know if it says that he has told you these things or have you read it in the notes? Whatever is given to you, use that. Okay. If it says that, okay, the person told you, okay, fine. If you read that in the notes, you can say, as far as I have read in the notes, or as far as what, Mr. Foster told me, that he continues to make careless mistakes while playing. Is that correct, Mr. Cox? What is your view on that? So you are not just throwing it at them, you're also getting their views. So they'll say, yeah, yeah, doctor, he does tend to do such things. Then I understand the concentration is impacted as well. Okay, he appears very distracted. Very important thing. I also read was, he was involved in some reckless driving. So that what is that? It's impulsivity. Yeah. So basically, you are saying that he's hyperactive, he's impulsive, and he's inattentive. All the features are still there, right? So you can check that. Is that correct, Mr. Cox? So probably most likely they'll say, yeah, yeah, doctor, and they'll give you one or two more examples. He got into a fight that the other day. Well, so these are the features of, which suggest that he still has some residual symptoms of ADHD. Okay, and that is also one of the reasons why we need to continue him on this medication, because I know it's a stimulant, but in his case it's going to help him focus better and help him improve in his game, so it should not be stopped. And if they say, no, doctor, it's a stimulant, so let me also tell you that previously he was tried on a non-stimulant medication. I wonder if you know anything about that. So keep involving them, see if they know, otherwise tell them. So there was a non-stimulant drug which was tried before. Don't say drug, say medication. And it gave him, unfortunately, he developed liver problems. So we can't give that medication. Regarding Chinese herb, you are fine. It's we don't know what the ingredients are. We don't know what the side effects are. We don't know how it will interact with his medication. So unfortunately, as per the guidelines which we use here, he should not be started on that. Okay. And the other thing about why are we still giving him if he's still showing symptoms? So you can say, well, that's a very good question. Many people, despite being on adequate dose, can show residual symptoms and still function well. Okay. So I understand he does have residual symptoms, but he's able to function more or less appropriately on the medication. If you think that the symptoms are actually going out of hand, I would suggest meeting with the doctor to optimize the medication if that's required. So, you are being open. You're not saying, well, this is the only dose, only medication. No, you're not the ADHD expert. Okay. So you are giving them options, which is a fact. Somebody on ADHD medication can have residual symptoms for life, but still be functioning. Okay. If the symptoms go out of hand, they need the medication optimization. Plus, if he's using drugs, that could be impacting as well. Okay. So say all these things. So when you say such, when you give such ideas, Examiner will think, okay, you've not just memorized your answers, you are actually listening to the actor and then giving your responses. Okay. The other thing about, that judo authority should allow, don't say such terms as well. Say things like, what actually happens is the judo coach would have need to apply a dispensation certificate. It's called medical dispensation certificate, which the person will apply from his end. Okay, so Mr. Cox would apply for a dispensation certificate. And you can also say it's best to apply as soon as possible. At times, it can take a while to come back. Okay, from your side, what you can do is you can give a summary of your assessment on why he needs medication. Okay, provide evidence that he still has ADHD. You can also get his previous records from the time when he was diagnosed with ADHD. You can get the medication history from the GP, citing why he cannot be tried on some other medication, which gave him liver problems. Okay, collectively, all the papers can be sent to the judo authority. If they say, "Is it sure that they are going to allow?" No, you don't know. Every organization and these uh, sports authorities, they function in a different way. They have separate set of rules. But it would be help, as far as what I mean, you can just do as much as you can, isn't it? So what you can say is, because I got this station in my main cask exam, and they said that, okay, doctor, what else can be done? I said, well, if they require a one-to-one review, or if they want any help from me, I'm happy to go ahead and meet with the team or meet with the authorized authorities if they want any further clarification from my end. Okay, because I would be very happy to see him play. Yeah, but you can't force them. If they don't want to do it, you can't do anything, right? So this is what you can send them. You can offer to provide support by meeting with them, giving them further clarification. That's it. And then ask the judo coach to apply for a dispensation certificate from his end. Okay. Energy within normal limits. Again, I didn't see anything which says his energy is beyond normal limits. Okay. See, these are small, small things. I'm sorry if I'm being picky, but then this is what actually happens in cast. They are very picky. Okay. Some actors will just overlook. They'll be like, okay, fine. You are from not some country where English is a first language. They'll just overlook that. But some, they are very nasty, and they'll hold it to them. Doctor, what is energy beyond normal limits? And then you won't know what to answer. Okay. Any questions? Is it clear?
Yeah.
Yes, sir. Thank you so much.
Yeah.
Yeah.
Okay.
Yeah.
Okay, then I'll see you all next week, same time. I'll
Thank
post
you.
it.
Thank you. Thank you. Thank you so
Bye.
much.
Thank you so
Bye.
much.
Bye-bye.